My name is Brinster. I'm Director of Aortic Surgery for Northwell Health. Our aortic service line is one of the largest in the country. We span a large geographical area across New York State, both within New York City and Long Island and Westchester. So a lot of it is about giving patients excellent care on their front step of their house. What drew me to aortic surgery is that it's intense in terms of helping patients in their most dire time. Minutes can count in these severe conditions, and there's no other hospital system in America that has coordinated on such a large scale their emergency medical services. A lot of aortic surgery patients need that constant follow-up for years later, and that's what our Center for Aortic Disease program has. One of the biggest benefits of being at Northwell Health is working with this nationally recognized cardiovascular service team. We have a Follow Your Heart program in which that we have nurses coming to the patient's house shortly after discharge to ensure that all the medications are properly being taken, blood pressure is okay, that they're moving around okay, and if they're not, we find out about it immediately. But we're able to proactively continue all of the great care they had in the hospital while they're at home. We believe that constant communication is a hallmark of the care that we provide.
Hello, this is Brinster, Director of Aortic Surgery, and welcome to the Center for Aortic Disease at Northwell Health. This brief educational video will describe the aortic program, the services offered, and review terms you may hear regarding aortic disease. The Center for Aortic Disease at Northwell Health performs more elective aortic surgeries than any other health system in New York State. And with New York's largest emergency medical transport team, we have the ability to rapidly transport the sickest patients when seconds count to perform life-saving procedures. The Center for Aortic Disease has proven itself as a leader both nationally and internationally in the treatment of life-threatening aortic dissections, performing more dissections than any other New York healthcare system, and is consistently one of the top international centers in volume in the prestigious International Registry of Aortic Dissection. The Center for Aortic Disease's Connective Tissue Clinic addresses the needs of our patients with Marfan syndrome and similar disease processes with a team approach including cardiology, genetic screening and consultation, orthopedics, and ophthalmology. The Center for Aortic Disease has a brief informational website for aortic patients found at www.heartprocedures.org, which will guide you through common aortic terms, diseases, and procedures. The aorta is the largest artery in the body. The heart pumps blood out of the heart, through the aortic valve, and into the aorta. The blood then travels up the ascending aorta, around the aortic arch and down the back, along the spine to the abdomen and then to the legs. An aortic aneurysm is an abnormal enlargement of the aorta. And like a balloon, as the aorta grows, the walls of the aorta grow weaker and weaker and can burst or rupture. The main risk factors for developing an aneurysm are age, smoking, and high blood pressure. Other risk factors include family history, bicuspid valve disease, and connective tissue disorders. Many times, patients with an aneurysm do not have any of these known risk factors. When the ascending aorta ruptures and has a dissection, patients require emergency surgery. Emergency surgery, even in highly skilled institutions, has a mortality of over 10%. Ideally, aortic aneurysms should be repaired before they become an emergency. A common question is when to operate or intervene on an aortic aneurysm. This depends on the family history, the patient's history, risk factors, and the size of the aneurysm. The average size of the ascending aorta that has an emergency dissection is approximately 5.3 centimeters. Often we use 5 centimeters as the criteria for performing elective surgery. If the patient has connective tissue disorders or a family history, the patient may be at a higher risk and should have a procedure at a smaller aortic size. To reduce the risk of our surgical procedures, most of the aortic valve procedures and aortic aneurysm surgeries that we perform are done through a minimally invasive incision. This requires dividing the breastbone only through the area required to see the valve and aneurysm. This smaller incision does not compromise the accuracy and precision of the surgery and allows a faster recovery and return to activities of daily living. An ascending aortic replacement is a relatively straightforward operation and involves replacing the aorta above the coronary arteries and aortic valve to the level of the head vessels. The aortic root is the first portion of the aorta as it leaves the heart. The aortic root is comprised of the aortic valve, the first portion of the ascending aorta, and the attachments for the coronary arteries which feed the heart. During aortic root surgery, the first portion of the aorta needs to be removed and replaced with a surgical tube graft. The coronary arteries are reattached to the surgical graft. The aortic valve can be replaced with an artificial valve, or the patient's own valve can be saved and sewn into the surgical graft in a procedure called a valve-sparing aortic root replacement. This procedure is performed at experienced aortic centers and avoids the risks of artificial valves. More advanced techniques are constantly being developed, and the center embraces the use of innovative technology to reduce the impact of treating aortic disease to the patients. We perform complex endovascular stent grafting, where an aneurysm can be repaired with just a needle stick in the groin and insertion of a thoracic stent graft which is positioned to cover the aneurysm, acting as a barrier to further aneurysm growth and rupture. Additional complex aortic procedures which the center performs are open surgical aortic arch aneurysm repair, descending thoracic abdominal aortic aneurysm repair, and so-called hybrid procedures that use endovascular and open surgical techniques. For those patients living with aortic disease, routine aortic surveillance with diagnostic imaging and follow-up in our aortic clinic is recommended. We also encourage a healthy lifestyle. This includes good blood pressure control, exercise, and a well-balanced diet. We encourage patients to avoid tobacco and any illicit drugs which may increase the risk of rupture or aneurysm growth. For further information about Northwell Center for Aortic Disease, please contact us at the following numbers. We offer telehealth visits, second opinions, and a friendly, informative staff. Thank you.